Thank you for joining us for Facebook Live. Norton Sports Health is starting a monthly informal discussion with our physicians about hot topics in sports medicine. Today we'll be talking with Dr. Tad Seifert, neurologist and concussion specialist. Hello, Dr. Seifert. Would you like to tell us a little bit about yourself?
Sure. I'm an adult trained neurologist here at Norton Healthcare. I got into the concussion world through my fellowship. I did a fellowship in headache and facial pain. My mentor in headache also happened to take care of a lot of the athletes in the Houston, Texas metro area, and that's where I really developed my interest in neurology, kind of merging into the sports medicine world.
Awesome. So what we're going to do is we've collected a couple questions that are usually frequently asked for you to answer. So let's begin. First question. Can someone get a concussion if they don't strike their head?
Absolutely. It's unusual, but it can happen. If someone gets hit significantly in the body or the torso that causes a significant whiplash movement of the head and neck, it's really that whiplash-like movement of the head and neck that causes the movement of the brain inside the skull that causes the injury of concussion. Usually that's from a direct hit to the head, but it does not have to be a direct hit to the head.
Okay. Can you have a concussion without getting knocked out or having, a couple minutes of what we'd call being blacked out?
Absolutely. In fact, the far minority of concussions involve loss of consciousness, less than 10%. And that's a big misnomer that we continue to try to educate athletes and coaches and educators on, is the fact that you do not have to be knocked out to have a concussion.
What are some symptoms beyond headaches? I think too often people think just a headache is the only symptom that comes with concussion. So what are some other ones that people should look for?
No, that's a good question. And headache, far and away, is the most common symptom, without question. About 94% of patients with sport concussion will report headache. But there are a multitude of other symptoms, and that includes nausea, cognitive slowing or problems with concentration and mental focus, dizziness, balance impairment, just significant fatigue, emotional changes. It can be any or all of those. So we have to be really, really diligent as medical providers and clinicians on the sideline and in the clinic to really look for those other symptoms other than headache.
So you work with a lot of athletic trainers in the community here in Louisville and throughout Kentucky. Would you just explain to people why you feel athletic trainers are so important to the management of concussions?
I think athletic trainers are crucial, and I'm really, I have a strong feeling about this, a strong opinion that if there's one thing that we can do in our secondary schools, in junior high schools, and certainly in high schools to decrease the risk of concussion, or to at least decrease the likelihood of complications from concussion, it's having a certified athletic trainer present. And that's because in most settings, in most game settings, there is not a physician present. So a certified athletic trainer is someone that's truly medically trained, that is our eyes and ears on the ground, and they're able to recognize an injury or a potential injury and subsequently remove that athlete from play and get them evaluated accordingly so that they're not returned to play and placed back into a situation where they can be injured further.
If for some reason a parent or coach suspects a concussion but there isn't a physician or an athletic trainer, should they remove them from competition?
They should. I would always err on the side of caution. Definitely at the high school or junior high or elementary school level. If there's not a medically trained professional there present to evaluate that student athlete and there is a suspicion of concussion, I would certainly err on the side of removing them from play so that they're not put back into a contact risk situation, which could potentially further that injury on a more severe level.
Now, we talk about football as a big issue with concussions. Obviously, with the NFL and all the work they're doing, there's a lot of talk about it. But is football the only sport that parents need to worry about concussions with?
Definitely not. And that's been another big misnomer that we've tried to educate individuals on. Concussion is not just a football injury. There are multiple other contact risk sports, soccer, lacrosse, field hockey, volleyball, Cheerleading, I see a lot of cheerleaders. Wrestling, I see a lot of boxers and mixed martial artists from the combat sports genre. Um, Concussion can happen in any physically active activity. I've even seen concussion in what folks consider the non-contact sports like swimming, cross country. If you're physically active, concussion is a risk for you in your sport.
So just to finish up, is there anything else that you think is important for parents or coaches to know about concussions?
Yeah, I always stress, the key is just knowing the student athlete. And obviously, no one knows the athlete better than the parent. But then furthermore, no one knows the athlete better than a certified athletic trainer that is there with them on a daily basis. And that's why, again, they're so crucial. The parents, the certified athletic trainers know when that student athlete is just not acting normally. And when that's the case, especially in the context of contact sports where head trauma exposure is present, that's when an athlete should be at least removed from play temporarily to be checked out in a standard fashion by a medically trained professional.
Thank you so much for having us, and thank you for everybody that watched today. If you'd like to see Dr. Tad Seifert, you can look up his phone number and address on the Norton Healthcare website.